Hi, Dr. Frega here with Ideal Health and Wellness, and this week I am 34 weeks pregnant. So nesting is definitely in full force, and I think my husband's feeling that a little bit too. So unfortunately, he's the one that has to probably do most of the legwork, but we're kind of getting things done. And excited and anticipating baby's birth soon. So this week I thought we would go through birth plans, because if you haven't by now, it's a good time to kind of start talking to your physician about what your birth plan is, as well as your partner. So they always say to kind of keep it to a page if you're going to type it out. Some facilities will actually give you their own birth plan pages to fill out yourself. It just kind of depends on the provider. So I type ours out. Our name is listed clearly at top, and then I kind of go through just some major points there in terms of what we want. So again, this is what my husband and I have already discussed of kind of how we want the birth to go and how we're hoping it will go. So since we've been through this before, really I just had to review it. And we added some things to it. Now, depending on the hospital or facility, some of these things may be automatic and some of them aren't. We will be traveling for a wedding close to the due date, so I'm definitely making sure that I have an extra copy. And even though some of the things are already offered at a hospital, I want to include it in just in case we did have to deliver somewhere else. So the first thing I go through is medication. We did not use medication with our first birth of our daughter and don't plan to this time, so I just kind of lay it out there that I don't want to use medication if possible. And then talking about, I lay out medical procedures. Do you want a saline lock that is recommended just in case of an emergency? It's already in place. So we agreed to that. I had mine placed above the wrist just to make it a little bit more comfortable so I can move around during labor and delivery as well too. And then we just had if there's any medical procedures, we would just ask that they give us time to discuss it so we can make an informed decision. The next thing is the labor. So we listed out just things like who would be in the labor and delivery room, which is just my husband. Some people have a doula. Some also might have family members or friends. So again, that's the area that we kind of listed that out in. And then, do you want, the door open, closed? Are you open to having students in with you? That kind of thing. Do you want lights on? Do you want the ability to dim them? Are you bringing any music to play? We kind of put those in our thing as well. Because we were doing a non-medicated birth and our hospital offered it, we asked that we be placed in a room with a big tub, so that would help with facilitate labor for pain management. We also asked for things like a ball to sit on, and just the ability to be able to get up and move around as well too. So I was not, luckily I did not have to be monitored during my labor, so I could get up and walk around and had that freedom too. Now again, plans are great, but sometimes we need to deviate from them. So I do encourage that you have, what you would like to happen, but as well as option B and C as well too. And then again, for the birth, I just listed that my husband would be the only one in the room with us. We did ask that they do delayed cord clamping. So we asked that they did not cut the cord until it was done pulsating. This is great because baby, if you do this, baby can get up to a year of their iron stores, as well as they're getting a lot of good nutrients and all of their stem cells as well too. Obviously, if you're doing cord banking, that changes that, and you'd want to include that in your birth plan so that your provider is aware of that as well too. And then I also put that I wanted my husband to be able to cut the cord as well. Postpartum, we just asked, and this is standard at our hospital, but again, we included it just in case, again, that plan B or C, if we had to deliver somewhere else, that the hospital would know that too. But we asked for that 1 hour of skin to skin. Again, it's great for bonding. For baby and for mom. It helps regulates baby's heart rate, their temperature. So it's, again, just really good thing to do. And again, consider that if your hospital does not offer that. Luckily, again, ours does. And then what you'd want to also include in there, do you want to vaccinate right away? How do you feel about vitamin K, eye ointment, that kind of stuff? So you'd want to include that in the plan as well. We also ask that baby stay in the room with us the whole time. And then again, at the bottom, I had, this is what I want, but in case that we have to deviate from our plan, if I had to have a cesarean section, those things, we explored those, what kind of things that I wanted. And again, if it was a C-section, again, I wanted my husband in the room, I wanted to be awake, and I wanted to be able, again, to nurse the baby right after. And again, things also that you'd want to include is if baby's staying in the room with you, are you planning to breastfeed, bottle feed? Do you want them to be offered a pacifier or not? Again, these are just things that you'd want to list on your birth plan. And again, there's really good examples online that you can pull up and look at if you're having, a hard time. But again, it's just something that you want to, talk about with your spouse and formulate together, and then have that conversation with your provider as well.